morning, everyone. So today we are dealing with the assessment of the musculoskeletal system, which is now consisting of the muscles and the skeleton, and with the brief knowledge that we have about the musculoskeletal system is that in most cases we understand the functions of the skeleton, right? That it provides protection, also production of red blood cells, and covering the body organs, the internal body organs, and for the muscles, they will cover everything so that now we have everything that we can call now, this is the human being. And now, when you go again to the skeleton, so like for today's lesson, we are going to focus on some of the joints, okay? We see the joints. Then we also focus on naming these bones. For example, we have the humerus, right? Yes. The humerus is down. The humerus. This is the bone. This is the humerus, isn't it? Okay. Then when you look at the humerus, we also have another bone, which is now the radius, right? The radius and the ulna. When you go to the lower extremities, you're going to find the femur. Then you're going to find the fibula and the tibia, isn't it? Yes. And now when you go to the hands, you're going to find some of the bones. For example, the carpal bones, right? Those that are found in the wrist. Then we have the metacarpals, these, okay? For example, we have the carpal bones, and the human body, the human being should have about the carpal bones, they are supposed to be 7, isn't it? Are they supposed to be 7 or 8? They're supposed to be 8, isn't it? 1, 2, 3, 4, 5, 6, 7, 8, okay? 8. Then when you count the metacarpals, okay? The metacarpals, 1, 2, 3, 4, 5. Then when you start from this one, when you start from these are the ones that are called the distal phalanx, the distal phalanx. Then this is the mid phalanx, and this is the what? The proximal, isn't it? Okay. Then when you look at it again, they have some joints, Okay. So we have the first joint you're going to see when you look at your fingers, okay. When you just do this, the first joint that you're going to find is the one which is now called the distal interphalangeal joint, okay? Then we have another joint which is now the proximal interphalangeal joint. Then when you go here, just here, okay? That's why now you're going to find the metacarpal interphalangeal joint. Are we together? Then again, when you look at this is the distal palm, the distal aspect of the hand, then this is the palm, right? When you look into your palm, you're going to see some creases, So you have the distal creases, the distal, the proximal, we have the palm, and all those. So they should be in line, okay? You are supposed to check all those things. Then when it comes to the muscles, probably you know the muscles, right? You know the muscles, maybe the deltoid, the gluteus, the maximum gluteus, and all those things. Now, looking at this, we need now to assess this particular patient because the patient has just come to your facility, and the patient probably is complaining of maybe pain in the joints, and we want to understand why we want to check for those. And a brief explanation we can give also the relationship with other systems is that in most cases we understand that everything is covered by the skin, right? And if everything is covered by the skin, that means the skin always remains as the most important aspect to talk about, because if there is a problem within the body, the skin will still react, isn't it? If there is a dislocation, you will see maybe redness of the skin, or maybe you will see something like cryptas, and you are still going to use the skin to assess those things. What else you are palpating? So now, during the assessment of the musculoskeletal system, we are going to use the 4 techniques. So now, what are these 4 techniques? Initially, we know the 4 techniques, which is palpation, inspection, percussion, and auscultation. But when you are dealing with this one, we are only going to inspect, then we palpate, and percuss, okay? Now, percussion is going to be a little bit different because we are supposed to percuss the patella, but now we are not going to percuss there. We are just going to do ballotment, which is now part and parcel of what? The palpation. So now, the 2 most important techniques we are going to use is just inspection. We are going to inspect and palpate, only those. These other systems, you are going to find that you are going to inspect, you are going to palpate, you are going to percuss, you are going to auscultate, right? Yes. But on this one, we are just going to use 2 techniques. Now, when a patient comes to your facility, what you need to understand is to get the history. Now, the history taking that we know is a general history taking, but each system has its own specific history taking. So when a patient comes to your facility, probably you're going to do the biography, okay? You're going to get that demographic data where there is biography, where you're going to find things to do with the social aspect, and after that, then you can now go to the past medical history of the patient, past surgical history of the patient. Now, when you're dealing with the musculator, because you want to do a specific history taken on that particular patient, you're going to specify only the musculator system. So even the conditions that you'll be asking, for those conditions that trans through the family, they are supposed to be related to what? To the musculator system. Are we together?
Yes.
Okay. So now we are going to start. So what we need the patient, just like we have the patient can just sit properly now. You can face your friends. Okay, so we're going to have the patient, this is the bed, then this cardiac table, for the sake of learning, we'll remove this pillow so that the patient, when we are palpating or inspecting the hands, we are going to inspect properly. Then we need gloves and the tape measure. The tape measure, we need to measure the length of the what? The arm, the circumference of the triceps and the biceps, right? And also the thigh. And also we need to measure the length of the leg. So that's why we are having the tape measure. To some extent, we need also to do what? As we are palpating, though patients, they become a little bit skeptical when they see you with gloves, they will start thinking like they are very sick even when they are not that much sick. But for the sake of infection control, we need to have a pair of gloves. And those are the things that we are going to start with. So now, to start with, we are going to inspect this particular patient. So how are we going to inspect the patient? Okay. So the first thing that we are going to do is to inspect the posture and the spinal cord. Okay. So now, how do we inspect the posture? So for example, this particular patient, we are going to inspect the patient posture. Now, there are some deformities that we can find in the patient, right? So now, when we are inspecting the posture, we are inspecting how the patient, the moment the patient comes in, the first thing that you are going to inspect is how the patient is walking. Are we together? So you inspect, we do not palpate how the patient is walking. We only inspect how is the patient walking. So when the patient comes in, you are going to inspect how is the patient walking like. Are we together? So now this particular patient, we will tell the patient to stand. Okay, so you can stand. So when the patient stands, you instruct the patient, more like the patient is flexing, more like the patient is going to touch the toes like that. Okay, so you can just go like you're touching the toes. Okay, now, okay. So now what we want to see is the spinal cord, right? So you can even inspect the spinal cord because it is supposed to be to be curved. Okay, so you can sit. You are supposed to inspect if the spinal cord is curved. Now, there are at times where you are going to find that the spinal cord is curved. If this is the spinal cord, then the spinal cord is curved like this. It is making something like an S structure. That is now what we call as scoliosis. Scoliosis. It's a curved spinal cord. Now, when you find that, then it has to do with it, and mostly you are going to find on the cervical and the thoracic. That's why you're going to find the cervical, the thoracic, and the lumbar. That's why you're going to find a spinal cord, which is what? So now you will find the patient is walking like this, right? You've seen a patient who walks like this, right?
Yes, sir.
Yes. Those, in most cases, it's because of the spinal cord, which is what? Which has the S-shaped, okay? So it is more like it is curved. Are we together? Now, sometimes you'll find a person is walking like this and you want to imitate them, not knowing what the problem is, okay? Then we also need to inspect, okay? So when you are inspecting, you also inspect what we are calling as the lordosis, right? So you can stand. So now, lordosis is normal in patients. You can face this side. Lordosis is normal in patients who are pregnant, right? We know how they walk, right? You will find them, they're walking like this, right? That's lordosis, right? So it is curved like it is inward. Why? Because what they are carrying maybe in front is heavy. So now, it's not like they want to show you that they are pregnant. No. It's just how the spinal now cord will start now in relation to what they are carrying. Right? So you will find out the patient when they stand. So now, how do we see that, okay, this particular patient has lordosis? So you tell the patient to stand, like this is the wall, right? Then they stand beneath the wall. Then you're going to see that there is that cave, okay? So now, if you find that there is that cave, then you need to further ask the patient, you can see, further ask the patient if the patient has been like that or the patient was just born like that. Is it functional or it's a deformity? Are we together? Yes. So now, even in toddlers, right, when they are walking, you will find the child is walking like this, right? That's what we are calling now as lordosis. So in children, or especially toddlers and pregnant women, lordosis is normal. But in a patient, because the patient is supposed to stand like this, isn't it? This is normal, isn't it? I don't know, maybe I'm having kyphosis. This is normal. This is normal. But if you find now, I'm standing like this, then there is a problem. Or I'm standing like this, then there is a problem. Because I will stand like this, then I go like that. Then there is a problem. Are we together? Okay. So that is the second deformity that you can find. Okay. The other deformity that you can find on the spinal is what we are calling as the kyphosis. Now, I think you have seen kyphosis. This is where you'll find this part, right? This part is like this, right? A person who walks like this, right? Yes. That's now where the spinal cord now, it makes that curve. And in most patients, it goes in grades, right? It goes in grades. So you will find that this part, it is like this, right? A person is walking like this. Maybe there is a fracture or something. So now you ask the patient why the patient is like that. Is it functional? Is that how they were born? Or is that maybe because they've been lifting, especially people who are found on the streets because they lift a lot of heavy things, right? So you'll find that now the spinal cord is now becoming injured. Then the last one that you can check is the gibbous. Gibbous, that's why you'll find this one is protruding, right? Protruding even the chest, okay? So you'll find that this part is protruding like that, even the chest, okay? I don't know how you call it in your language, but that is now gibbous if you have seen patients like that. So those are the things that you are going to inspect on the what? On the posture. So posture is how the patient is standing. So when the patient is standing like this, then you start now inspecting how they are standing. Are we together? So during inspection, you can even palpate. Okay, so what are we palpating? Probably you know how to stand when you're palpating the patient. So the patient has to sit like this, right? Then you come, because the patient will be on the chair, then you come a chair like that one. Then you start now palpating the what? The cervical what? The cervical, from the cervical, you just check, you are palpating, okay? So during palpating the patient, you can just like that, okay? The patient has to flex like that. Then you start palpating using what? Your two thumbs. You are going to start from these two. When you just do this, there are two protruding spinal bones there. So you start from there. Remember, this particular patient is supposed to be dressed in the hospital gown. We know the hospital gown, right? Mm-hmm. So when you're palpating this side, okay, you are supposed to be what? In gloves, okay? As long as you're palpating, you're supposed to be in gloves. So now you're going to open you're going to open, like, you undress the patient so that you can just expose the back. Then you start now palpating. As you are palpating, you're going to find that some of the spinal bones, they are maybe depressed, right? Some, they are protruding. So you're going to notice those what? Until you reach the iliac crest, right? Until you reach the iliac crest, then you can stop palpating. Are we together? So those are the things that you're supposed to check on that and those abnormalities. Now, when you find that everything is okay, you are going to write the posture is what? Erect. So if the posture is erect, the patient is standing like this, right? It is normal. The posture is erect. The next thing is the head. Okay, how is the head? Because some you will find that a person has been like this, right? How is the head? Is the head upright? Right? So on the head, you are not palpating, but you are inspecting. When the patient is sitting, you tell the patient to stand, okay? You tell the patient to stand. As you are inspecting everything, you tell the patient to stand upright so that you can check if the head is like this or the head is like this or the person cannot even stand, maybe just like this. So now you're going to write the head is in the midline. The spinal curve, noted there is no kyphosis, there is no rhodosis, there is no gibbous, and also as you are aligning, you can even tell the patient to sleep on the bed, okay, the examination table, so that you can check also for the knees, the alignment of the what? The body. Are we together? The next thing that we are going to inspect is the gait, okay, how the patient is walking, How the patient is walking, how is the patient walking? Because there are some deformities or abnormalities, or there are some conditions that can cause the patient to go into hemiplegic. Hemiplegic, we know hemiplegic, Hemiplegia, where probably maybe the patient can also suffer, maybe the patient is suffering from a brain tumor or multiple sclerosis, or the patient is suffering from CVA, which is stroke in layman's language. You'll find that as they are walking, the way they walk, I think you have seen the patient who is walking like this, The patient will be walking like this, Yes. So now you will find that if it is not just maybe the patient suffered from the hip joint fracture or any dislocation, you will find that now that particular patient, so you will find that this one is not working, isn't it? So that is now hemiplegia. Hello. Then there's also wandering. As the patient is walking, how is the patient walking? For example, the patient who is pregnant, probably when the pregnancy is at that stage, the patient will be walking like this. The patient is just pregnant, maybe. It's normal for them. Or the child, a child who is learning how to walk, you will find they are walking like that. That is now wandering, okay? Now, looking at me, who is just normal, everything is okay, then I'm the one who is walking like this. Probably you will start now thinking, what could be the problem? Is he having maybe some dislocation in the joints, or is he having some pain sensation? Okay, the other one, it's what we call, there is also another one, which is the step cage. So step page is where now the person is walking like this, I think you have seen a person walking like that, where they are swinging the leg, Sometimes it will even be slapping on the water, on the ground. It's especially patients who are suffering from multiple sclerosis or CVA. Those patients. So when you see the patient is coming in, how is the patient walking? Is the patient walking like this? Right? You will tell to say there is a problem. Or the patient is walking like this, or wandering, or the step page. So those are the things that you can notice when it comes to gait. Okay? Then cerebral, when it comes now to the other part of inspection, how is the patient balancing? Okay? So now balancing of the patient goes like this. Okay? So now we want to balance, it's the coordination, because we are dealing with the cerebral aspect. So now, this is the patient, right? Can I have the chair? So we have this particular patient. So now, you tell the patient to stand up. You want to see coordination. So there is what we call Romberg's test, the Romberg test. So now, this is the patient standing up. You can close, you stand like this. Okay? Yeah, this is the patient. So now, look up. So you tell the patient to close the eyes. You can close. Then you do like this. At least for 30 to 1 minute, 30 seconds to 1 minute. Then, you know that when you have closed your eyes, the balancing goes. Even in jail, some of you will only stand because there is a chair in front of you, so you are going to hold the chair. So now, you tell the patient to close the eyes for about 30 seconds to 1 minute, so, or 45 seconds. You will see the patient, whilst the patient is standing, you start now seeing like this. Then you know that there is no balancing, right? So what could be the problem? Probably maybe the patient is suffering from, you can see, the patient is suffering from maybe issues to do with the cranial nerve number 8, which is the vestibular cochlear cranial nerve, which is number 8. Because when the patient has hearing problems, especially if they have hearing problems, for example, maybe an infection of the ears, the balancing goes because it is affecting the vestibular cochlear. So now once the balancing goes, you'll find that even the way the patient will be walking, the patient cannot stand for a long period of time, right? Then the other one is where now you as the assessor, who is the clinical nurse, sits like that, then the patient. So now what we are going to do is, if the point passed, okay, you can stand, then you face me. So now, I will tell the patient that, I will tell the patient, I will do this, right? We want to see the balancing. So now the coordination here is the patient shaking, okay? So now I will do this, okay? This is the pronation, right? Pronator drift, where we just use it, one finger like that. Then this particular patient will touch here, okay? Then after the patient touches here, I will tell the patient to lift his what? To lift his arm. Then he closes the eyes. When he closes the eyes, I need to tell him to say, now you touch the finger. What else? Me, I'm not even shaking, okay? Are we together?
Yes, sir.
Okay, so now you touch it. Up. You can lift your, just lift like that, okay? Yes, then you close your eyes. You can touch it. So now, what we want to see, you can see, what we want to see is the patient shaking, because you find when you close your eyes, the patient will be like, so now there is no coordination, there is no balance in the what? In the muscles, okay? The other one is now where we tell the patient, you can do another one, then stand. So I will do this, and then I will tell the patient to touch using the same index fingers to touch it on my index fingers. You can touch. Okay? You can lift your arm. You can close your eyes. Come back. You can touch. Okay. You can. So you are not observing where the patient is coming. You are observing the shaking of the hands. And that's how now we can check for the coordination. Okay? So now, the other one, it's also about the gait where we call the cadence. I think cadence where you tell the patient to walk, right? So now you are counting the number of steps the patient is making in a specific period of time. So maybe you tell the patient to say, can you walk maybe for 30 seconds? Then you are not walking. You need to start now assessing or counting the number of what steps and how is the patient walking. So during the gait, you are checking how the patient is walking and the number of steps the patient is is making. Okay. Then we go to the measurements. Okay. So now the measurements, this is where now we need to measure the patient arm length and the leg length. Okay. So the patient, you can just lift. So now you are supposed to be in supine position. Then when the patient is in supine position, so now when you are measuring the leg length, you are starting from the anterior what? Iliac crest, from here, then up to where? Up to the ankle down there. Can I have the tape measure? So you make sure that, remember the patient is in the hospital gown, right? So you're just going to expose the part you are measuring. So the calibration is one it's here up to somewhere there, okay? So you're going to find that according to what I'm seeing here, because you're going to the iliac crest here, but the anterior aspect, then you measure, so I'm finding 85.5. Then you also check from the other end, because this particular patient is supposed to be on the examination table. So you're going to check also. Now, the difference shouldn't be more than a centimeter. So you will find that there are those patients, probably they had maybe a fracture, and you find that this leg is shorter than the other one, right? So you're going to notice. So now when you ask, you find that maybe this one is 85.5, then the other one you'll find it's 87.5. You are going to ask the patient, do you have any fracture? Are we together? Yes, when you are done with this, you can now go to the arm length, right? Remember, you are supposed to be recording. So now you are going to come from the acromion process there up to the mid finger. So you will only expose this part so that you are able to see. So the acromion process, it's just this bone. Okay. From there, you go now, you tell the patient, so the patient has to do like that. Okay. For example, this pattern up to the acromion process, isn't it? Okay, so what is it giving us? 76.3. Then you also do the same thing from the other end, and it should give you the same, or the difference should be less than a centimeter. Are we together?
Yes, sir.
The other length that you are supposed to check is the circumference. Eh? So now the circumference, you are going to do it that way. Okay. So the mid part of where the triceps and the biceps are, then we are going to check. So for me, I'm finding 25.5 the side. Let's see if we can have 25.5 again from this side. That is centimeters. Eh? And you need to notice that people who goes for gym, they have big muscles. Eh? Okay. The tape measure is not supposed to be tight. Okay. So when you take it there, so it's not supposed to be tight. Okay, so we are having 25.5, okay? Then you also go to the leg, eh? So we don't check from here, but we are checking from where? So now the patient is not supposed to be in a trousers or whatever, especially if the patient is maybe it's the male patient, they are supposed to be, at least they should just remain in their boxers, eh? Okay, but you also maintain the professional ethics. So, just the middle thigh. So we are having 43.8. Let's get from the other one. So we are still having the same 43.8. You record and you note the findings. If there is any abnormality, for example, hypertrophy, or where maybe, for example, this side, you'll find that the patient who had the plaster of Paris, you're going to find that the arm does what? It starts shrinking, isn't it? It starts shrinking. So now you're going to notice what could be the problem, isn't it? Okay. Then if there's anything, the muscles maybe they have started shrinking, or there are some abnormalities that are there, okay? So now from there, what we are going to inspect or palpate now is the muscle tone, okay? The muscle tone and the muscle strength. Now here, you need to do simultaneous with what? Because as you are doing for the muscle strength and everything, you are now palpating now. You are supposed to be palpating and inspecting, because you are supposed to be seeing the patient is what? Facial expression, okay? So now, there are certain terminologies that we can be using. So now, for the muscle strength, now, when I start palpating, I tell the patient, okay, because I know the patient's name, and I'll tell the patient to say, I just want to touch so that I can see if you are having what? Some muscle pain, right? So you start from this part, okay? From the shoulders, okay? You start from there, you are palpating, okay? You are palpating, you palpate. When you come to the legs, you palpate, then you are noticing the facial expression. If the patient shows that the facial expression the patient is showing is about probably maybe the eyes are contracting, you know that maybe it's painful. You ask them if they are feeling any pain, right? Okay, so from there you can tell the patient to sit, okay? Why is the patient sitting? I want to palpate from this part up to what? The scapula. So you're going to stand behind so that now you can palpate, because you can find that maybe from here there is the dislocation, right? Or the clavicle bone is dislocated. So you start palpating, okay? You palpate just like that so that you can feel if the patient is what? Having some pain. The other way, you tell the patient to lift the arms like that so that you can palpate in the what? You check for the ribs. You will find that as you are palpating, remember you are palpating while you are in gloves, as you are palpating, you will find that this particular patient maybe has a fractured what? Rib. You need to notice all those, okay? Now, the other thing that you are going to do is now, to see now, is the patient having some dislocation, right? So now, this is where now, when the arm is like this, right? when the arms are like this, we call this is what? Extension, right? Now, hyperextension is like this, isn't it? But when you flex like that, this is the flexion, right? So now we want to see. Then, when you do like this is circumduction, right? Yes. When I do this, you see, flexion, extension, isn't it? When I'm standing like this, then I do this, is what? Abduction, then adduction. Are we together? So even when I do this is what? Abduction. But when I bring it closer, this is what? Adduction. Are we together? So those are the ones that we want to check. Now, this particular patient, okay? This particular patient, we want to check if the patient has a deformity on the what? Or the dislocation on the what? On the hip, right? Now, what do we do? There is what we call, you are going to flex like that, but now the trousers is shorter, is somehow is small. So now, the patient also. Okay. So now, we want to do autoline test. Autoline. O-R-T. Okay. The autoline test, eh? So the autoline test is where now you do this, eh? You are checking also for the knee. Are you together? Then you are just going to flex it, okay? You have to flex. Then the patient, sometimes, especially for old people, you even hear some bones doing like in, right? Yes. So now when you are doing autoline test, we are just flex. Okay. So when I reach here, I need to do what? To check if the patient is having some what? Deformities or dislocation. Because the leg was extended like that, but now I flex the leg, and what am I getting from here? I want to see if there is a dislocation. Then I go like that. So now when I flex it like that, that is where now I need to check if the patient has what? The dislocation on the what? On the hips. Okay? So when I check from this part, I go also to this part and do what? Check the same way. That is now what we are calling as what? The autoline what? Test. Is it Thomas? Yes, this is the Thomas test time, not the autoline test. This is what? The Thomas test. Are we together? Hello? Okay, so this is the what? The Thomas test. Okay. The other one that we need to check is now, we are still on the lower limb, right? Let's check for the internal rotation. So now you do like this, right? So now you're going to flex you go like that, right? So that is now the internal what? Test, okay? Internal rotation, because you want to see if there is a problem here and there is a problem on the what? On the hip. Then the other one, you do like this, right? Which is now the external what? Rotation, right? It's the external rotation. The patient will still tell, you can tell that the patient is having some dislocation or there are no dislocation. The other one, we are still here, we can check for the what? Ballotment of the what? The patella. Ballotment of the patella. So now, if there are a lot of fluids on this joint, you're going to feel it, okay? So you're just ballotting, okay? You're just ballotting because the patella, the way the patella is designed, you can ballot it, okay? Okay, now we are done with this. You can just stand now. You can stand. Okay. So now, we want to check if the patient has what? Some dislocation where? On the couple what? The wrist, right? So now, you can sit. Sit. Just sit. So now, you're going to instruct the patient, right? Okay, you're going to instruct the patient. By the way, the Mercury test is the one which is going, is it the one which is going in? Which is going out, isn't it? That is the Mercury. Then the up leg is the external. Okay, external rotation, when you are doing the rotation on the leg, the Mercury is the one which is going in, then the up leg is going out. Now, this is the patient, right? So now we want to check. So now we have what we call the phalanx, right? the following test, okay? The following test, you tell the patient to do this. Can you do this? So now, if there is any problem here, the patient will tell you what? That there is, I'm having some pain. You can tell like that. Then we are still on the what? On the palm. Right? The other thing you can tell the patient is to extend you can extend like this. Maybe even you can extend. Probably we can have a patient. Okay, you extend. Then, so this is it. Pronation, right? Suppression, you do like this. Supination, pronation, okay? Then, the other one, you do like this. Can we make the fist? A strong one. We make the fist. Don't do like this, eh? You make a fist. Are we able to make a fist? Spell it. Don't pretend if it's spell. Okay. You can now do this. Then the other one, we want to see if the joints are having some problems, eh? The coordination of the what? The fingers. So now you do this, eh? Let's do this. Okay. Then we get this finger and you touch it, eh? Are we having some pain? Number one. Number two, up to you finish it. And that's when now you can make the fist. So we want to see the coordination and if there are some joints. Then the other one is now you do like this, then you flex them like that, right? Extend them, then you flex them like that. And that's how we check if the joints are what? They are having any problem. The other one, once the patient is doing like this, they are extending. You tell them to do what? Supination like this. Then they do what? They flex. Okay? So you start with one, okay? Then they flex like that, okay? They extend, they flex. Extend, they flex. Out together. Yes, then the other one where you're going to, because you're supposed to be doing double. When they do this side and they do the same thing on the other end. Okay? Then the other one is where now you want to see is the patient having any dislocation on the what? On the shoulder joints, right? So now how do we check for the shoulder joints? You tell the patient to stand like this, then they do what? They extend like that, okay? So this is what? Abduction, isn't it? Adduction, abduction. So now, if the patient, especially for those who have gone for, maybe who goes for gym, for the first time when you lift something, you will feel pain, right? Maybe it's just because of the muscles, right? But now for the joints, you will feel now the joints here. Even the pain there, you can tell that there is pain, isn't it? Because we want to check for the muscle tone and the muscle strength. So now, as the patient is doing the abduction, okay, as the patient is doing the abduction like that, you are noticing if the patient is having some pain in the what? In the muscle, which is muscle tenderness, or if the patient is having what? Maybe some pain in the what? In the shoulder joint. Are we together? So now, when the patient is standing like this, then you tell the patient to do abduction, adduction, right? Abduction, adduction, okay? So now when they do abduction, they are also now extended. Now you tell them to do what? To do hyperextension, right? Where they do like this, right? Okay? Then you also do the same, okay? Then there is also another one where you tell the patient to do what? Circumduction, isn't it? Where they are rotating like that. Because as they are rotating, what is working here is what? The shoulder joint, because there is a ball and socket. And also the what? The muscles, okay? The strength of the muscles. So when they do on the other end, you take them, again they do the same thing. Are we together? Mm-hmm. Then if you want to see also if the scapula, the scapulae, this is the scapulae, isn't it? Mm-hmm. If it is involved, okay, you will tell the patient to do this. I don't know if we can manage. You will tell the patient to touch here. You will find that the moment they just start doing this, if they have any problem on the ribs, they are going to respond to that pain. Okay? If there is a problem on the shoulder, they are going to respond to that shoulder pain. If there is a problem in the muscle tone, they are going to respond. So now, when you tell them to touch that, then you can even help them to do this, where they just touch. Are we together? Are we able to do that? Yes. Or it will be so painful? So those are the things that we can check also. So now, there is also where we check now the shoulders. We want to see if there is maybe there is a dislocation there. Now, how do we check? You can see it. How do we check for the shoulder? Because we are checking for the cranial nerve number 11. Cranial nerve number 11 is what? Accessory, isn't it? Okay. Now, you will tell the patient to lift the shoulders. Eh? Can you lift the shoulders? You're just lifting them like this. Eh? Okay, lift them. You're having something to say like this. Oh, you usually like this down. Yeah, so we have a patient. Eh? We have finally found the problem. So we'll do now the focus. We'll do a focus now is detecting. Eh? So now the patient, can you lift? You're having some pain. Yes. On the what?
Right here.
Just right here? Okay, so now the patient is saying, I'm feeling something. When I press like that, are you able to rotate the shoulders like you swing them like this? Are you able to do that?
This side.
This side you can do, but this side is. So there's a problem with this patient, right? So that's why now you as you are doing physical examination on this particular patient, when you are done, because the patient told you to say, I have some pain, isn't it? Now, before you do everything, you need to inspect, because the patient can say, I have some pain here. What else? There's also somewhere where the patient cannot tell you. And that's the importance of what? Physical assessment, where you need to assess the patient. Now, when the patient says, oh, just here, there's a problem, then you can now go into details and start now asking the patient. When you are done with what? All the assessment, you start now asking, okay? I can also stand like this and tell the patient to look this side. Okay, you can look. Which one is your left side? Okay, left, right, up, down. If the patient has any deformity, the patient will tell you. Okay, are we together? So that's how we do the assessment of the musculoskeletal system. So the moment the patient tells you to say, I have a problem here, that's when now you do now a more focused history taking and examination of that part, so that now you can see the problem, because you are a clinical nurse and you are supposed to do that. Are we together? Okay. So that's the end of the assessment of the musculoskeletal system.